He is an American advocate for health insurance payment reform. He is former health insurance industry executive, a communication director. He is a New York Times bestselling author of Nation on the Take, How Big Money Corrupts Our Democracy and What We Can Do About It. And the second book, Deadly Spin, an insurance company insider speaks out on how. A critic of HMOs and the tactics used by health insurers, Wendell Potter is one of our leading national advocates for major reforms of the health insurance industry, including a supporter of Medicare for All and universal health care. He is a voice that every American must hear. Wendell Potter, welcome to Politics Done Right.
Thank you. My pleasure. Thanks for having me on again.
Let me tell you, I think more than ever, especially today, we're a few days away from the 7th. People need to learn a whole lot about what Medicare is, what Medicare Advantage is as well, and how insurance companies are corrupting what Medicare was supposed to be. So my first question to you is, why did we ever need Medicare, just traditional Medicare?
We needed it because insurance companies were just not interested in selling health insurance people to senior citizens, people as they got older. If they were charging premiums so high that people just couldn't afford it. So we had a real crisis of our senior citizens being deep in poverty in many cases. Only a small number of our senior citizens were able to buy health insurance at that time. So you have an enormous number of people who had reached 65 or older who just didn't have any insurance at all. That was why. And it's because, again, insurance companies were just not interested in selling them anything because they knew that as you get older, you're more likely to need more care. And so they just pretty much blackball people.
Now, how did we pay for this? In other words, one of the reasons that the insurance companies didn't sell to the people of elderly is, again, it cost too much. The people couldn't afford it. So the government created a particular way to pay for it that actually works. So what was that?
Yeah, and it's a publicly funded program, has been since its inception. That means it's funded with our money that we pay in taxes in one form or another. And we have, if we work, we notice that we have deductions from our paycheck that goes to the Medicare Trust Fund that builds up over the years. So as we're of working age, we pay into that. And then when we reach retirement age, it's there for us. We pay for this in our earlier years and take advantage of it. If we live to be that old, if we reach our mid-60s, it's there for us.
Now, what that means then is what the insurance companies couldn't pay for because, again, it was more individualized. Because we did it as a collective, we were able to collect enough money from the entire society to pay for the health care of all of us as we get older. Something that went from let's call it, from the able-bodied to the not so able-bodied, correct?
That's right. In fact, it's basically the system that works around the world and actually worked initially for a brief period of time in this country. Our system of health insurance began in the late 1920s, early 1930s on the West Coast with Kaiser Permanente and its system of integrated care, which was kind of the forerunner of HMOs, and what was the forerunner of the Blue Cross system in Houston, Texas, Dallas, Texas. And the health insurance at that time was what's called community rating. Everybody, regardless of age or health, paid the same amount of money. And that worked until big insurance companies saw an opportunity to come into the market and make money by siphoning off younger and healthier people away from that. And so that destroyed the whole concept of community rating.
Now, the reason I wanted to start there is I wanted people to understand how Medicare came into being. The private sector refused to cover people. The government, we the people, found a way in which we could collectively take care of people. So now there was a funding mechanism, as you just explained, even tried earlier on with Kaiser as well, a tried and true mechanism that worked successfully.
Yeah.
Now, what is your expertise? You were what we called for quite some time the whistleblower for insurance companies. Tell us a little bit about that, because when I move into Medicare Advantage, I want to use some of that as you being the authority on the subject.
Yeah, I worked inside the insurance industry for 20 years. It was not my first career. I was a newspaper reporter, a journalist in my first career, but I was kind of lured into public relations work because it's a higher paying profession generally. And I wound up doing quite well. And I was recruited first to work for Humana, which is a very large insurance company. And I was there for 4 years. And then from there, I was recruited to Cigna, and I was there for more than 15 years. So altogether, about 2 decades working inside two of the biggest insurance companies. They're both for-profit. They're both listed on the New York Stock Exchange. And I got a great education of what that really means to people who are enrolled in these plans and what it means to our healthcare system. Like I said, in the early years of the last century, and from 1929 to into the 30s, there were very few for-profit insurance companies. In fact, almost all of the Blue Cross plans operated on a nonprofit basis until the 1990s, and then some of them began converting to for-profit status. So a lot of people don't realize that, and not so many years ago, health insurance in this country was on a nonprofit basis, but now it's been taken over by these companies like Cigna and Humana and United Health Group and Aetna, which is owned by CVS, and a few others. There are 7 large for-profit corporations that control both the Medicare Advantage business and commercial insurance. So we are kind of captive in this system now, and we're our healthcare system, and certainly our system of health insurance, is controlled by Wall Street. I saw that up close during my time at Cigna, because one of my responsibilities was to handle financial communications. I had to know all about how the company made money and where it went, and who really are the most important stakeholders for the company. And it became abundantly clear that the most important stakeholder for these companies are investors, institutional investors, and a small number of Wall Street financial analysts. They're the ones that the CEO and the CFO pay most attention to, and they worship it at the New York Stock Exchange.
So, what does that mean for the average recipient of healthcare services from an insurance company? What does that mean to them? How does the insurance company then make its money?
Well, they make their money because there is, for most of us, no Medicare that's available to us. So it's the only game in town for those of us who are not eligible for a Medicare or Medicaid program or a VA program. So the vast majority of Americans have to get insurance from one of these companies, or so, there are still a few remaining nonprofit health plans, including a few nonprofit blues plans. But what people need to understand is that what Wall Street wants is not what we need. Wall Street wants these companies to pay less and less on our claims, and to refuse more care, to deny more care year in and year out. Because the less these companies pay in claims, the more money is left over to reward those shareholders, to make them richer, to enhance the value of their shares. So that's what it's all about. And that's why you see so many people these days not getting the care that they need. They're not getting the care that they need because insurance companies are engaging in a practice called prior authorization, in which they will overrule what your doctor says you need and will refuse to cover medically necessary care. Often is not an outright denial as much as it is a delay. And in many cases, that's just as bad, because if you're sick, you need, in many cases, care right away. You can't afford not to get care right away. But they also make you pay a lot of money out of your own pocket before your coverage kicks in these days. Not only do we have to pay thousands of dollars every year in premiums, but they now make you pay hundreds and sometimes thousands of dollars out of your own pocket before your coverage kicks in. So that's a deterrent from people even using their health insurance. They can't use it because they can't afford to meet those deductibles. They don't have the money to pay out of pocket. So they're paying good money in premiums for something they really can't use. Often they have no choice. They get sick. They have to go to the emergency room. They get admitted to the hospital, and then they're hit with these enormous out-of-pocket expenses. So it's and another thing that is increasingly a practice within this industry is restricting our access to doctors and hospitals of our choice. They're increasingly narrowing their networks. They call it narrowing their networks by kicking more and more doctors and hospitals out of their networks. So we have fewer choices. So every year we're paying more and more for our health insurance and getting less and less for it.
Okay, now centralize it on Medicare versus Medicare Advantage. You explained earlier at the beginning of the program how Medicare works, how it was paid for. Traditional Medicare, well, why don't you tell us what's the difference between traditional Medicare and Medicare Advantage? And then we'll go into exactly why people should refrain from Medicare Advantage.
Yeah, Medicare, it's also called original Medicare or traditional Medicare, differs in very important ways from Medicare Advantage and from commercial plans. The Medicare Advantage plans, it's important to understand, it's not Medicare, it's Medicare replacement. It's called Medicare Advantage, but in many cases, it certainly is not an advantage. It's something that the industry was able to get lawmakers to go along with and call it that. And they've been fooling people for now many, many years, thinking that there is some real advantage to these plans. And yes, sometimes you pay less, but you never understand what the downsides are. But first of all, back to traditional Medicare. It rarely ever uses prior authorization. You almost never get a denial from the Medicare program. It is publicly funded and publicly administrated, so the administrative costs are very, very, very low. There are no networks. Almost every doctor and hospital that practices in this country is a part of Medicare. They want to participate, so they meet certain requirements to be able to do that. So we have access to almost unlimited doctors and hospitals in this country, regardless of where we live. We can go, I'm in Philadelphia, I can, if I need care and want to get care in California, I can do that, and it'll be covered. That is not the case with Medicare Advantage. They often will refuse to pay for medically necessary care. They will often exclude the doctors and hospitals that we want to use. And if you inadvertently or knowingly go out of network, you can pay an enormous amount of money out of your own pocket for that care. So they never tell you these things. You never see these things mentioned in their advertising. And so they're able to lure people into these plans. And people don't even realize until it's frankly too late when they get sick and they realize that, my health insurer is refusing to pay for care that might save my life, might free me of pain, might I might not have access to a center of excellence or a doctor that's renowned. I may not even be able to go out of my state to get care, or in many cases, outside my county. People don't understand how restrictive these plans really are.
Now, when we talk about restrictions as well, isn't it true that if you also make the mistake to go into Medicare Advantage, getting out of it, if you decide it just isn't for you, it is almost impossible. Well, not all impossible, but very difficult to move back to traditional Medicare?
It is. It's not prohibited, but it's very difficult and it can be quite expensive. The rules are that when you become Medicare eligible, you can also buy a Medicare supplement policy. One of the downsides of traditional Medicare is the fact that it is based on insurance policies that were prevalent at the time that paid for 80% of care, and you had to pay for 20%. Back in the 1960s, that was prevalent, and healthcare was a lot less expensive than it is now. So 20% of the hospital bill in 1965 was a heck of a lot less, even adjusted for inflation, than it is now. So it's important for people, if they can afford it and they enroll in traditional or original Medicare, which I encourage everyone to do when you have that option. And everyone has that option. But it's important, if you can afford it, to get a Medicare supplement policy to cover those out-of-pockets. I've been in Medicare, original Medicare for several years now. I pay for a Medicare supplement policy, and I never have an out-of-pocket expense. All these years, I've never paid a penny out of pocket because I have this supplement policy. But it can be expensive, and people, as they get older, they're usually on fixed incomes, or many of them are. And so they see that as something that they either can't afford, or they look at Medicare Advantage and they say, well, that's a bargain. I can enroll in a Medicare Advantage plan. And they just don't pay attention to those downsides. But you can, if you are in a Medicare Advantage plan, you can leave it. But the problem is you may have a difficult time getting an affordable Medicare supplement policy. When you're first eligible for Medicare for the first 6 months, you can buy a Medicare supplement policy without going through medical underwriting. So you don't have to disclose that you've got a pre-existing condition or anything like that. But if you enroll in Medicare Advantage first and are in that plan for, say, a year, you're going to be, if you try to go back in traditional Medicare, you can, but you may have a challenging time finding an affordable Medicare supplement policy, because then you are subject to medical underwriting. And if you've got a pre-existing condition, you may have to pay considerably more for your Medicare supplement policy than you would have if you had gotten it when you were first eligible for Medicare.
Now, Wendell, isn't it true also that as far as what it costs the government on a per person basis, Medicare Advantage is the government puts out a lot more for Medicare Advantage than traditional Medicare?
Oh, yes, absolutely. Insurance companies will claim that it's a more cost-effective way of providing care to Medicare enrollees or Medicare beneficiaries. That is absolutely not true. There have been many, many, many studies that have shown that it's far more expensive. It was created under the pretense that it would save taxpayers money. And the government wouldn't have to spend as much money. It has done exactly the opposite of that, because studies have shown that every Medicare Advantage enrollee, on average, the government spends about $2,000 more a year than they would if that person was in traditional Medicare. So it's very cost ineffective. It's actually depleting the Medicare trust fund, because it's far more costly than traditional Medicare.
It almost seems like if we got rid of Medicare Advantage and put that extra money we give to Medicare Advantage into eliminating that 20% that 20% supplement, it'll actually be more cost effective.
Oh, it'd be far more cost effective. And not only that, but these companies, that participate in the Medicare Advantage program, these private insurers like Humana, like United Healthcare, like Aetna, they are cheating the government by rigging a part of the Medicare Advantage program that enables them to grab billions of dollars.
Explain that, because I think there's a method that they have, like 2 or 3 tiers, the way they bill the government per person, and they try to make it sicker for the government, but less sick for what they're really paying, something to that effect.
Yeah, here's the game. They initially, in the Medicare, the private Medicare business, the insurers were trying to avoid enrolling people who were sick, who had a pre-existing condition. We had something going on that was referred to as cherry picking and lemon dropping. These companies would go to great lengths to try to choose only the youngest and healthiest people to enroll in their Medicare Advantage plans. And if they made a mistake, if they enrolled people who had medical needs, they often would try to get rid of them. And that was called lemon dropping, canceling their policies, running them off. So Congress said, well, let's try to fix that. Let's assure these private insurance companies that we will pay them more for their sick patients than we have in the past. So when that was created, it created something called the risk scoring system. The government did, so that, for example, if I had diabetes, I don't, but if I had diabetes, I would be the government would pay my insurance company more, my Medicare Advantage company more, because I have diabetes. What the insurers have done is manufacture illnesses for a lot of people, and it's called manipulating this risk scoring system. And it's been estimated by MedPAC, which is the entity that advises the federal government on Medicare, that this year alone, the government will be overpaying these companies at least $84 billion
for 1 year.
For 1 year. Some estimates are considerably higher than that. I've seen estimates of $140 billion a year. We're talking about 1 year now. If you look over 10 years, you're talking over $1 trillion that we are wasting. We're spending on these companies, giving them money that they're not entitled to because of the way they're cheating us.
And that goes right into the pockets of the shareholders and the bonuses. So it's a wealth transfer. One last question. What I know you support Medicare for All. How do we get there? How do we start working on, first of all, getting people to realize that Medicare Advantage is just not an advantage for them? I know you've been doing a lot of work with the newsletter that you have, which we're going to put in the blog as well. You have a great newsletter, Healthcare Uncovered. Great newsletter, Healthcare Uncovered on Substack. It's a learning experience when you go over to that Substack. But please tell us, what can we do?
Well, part of it is what you and I are doing, which is educating the public, and we can't rely on the traditional media to do that work for us for a variety of reasons. Increasingly, though, reporters are covering Medicare Advantage in ways that they haven't before, but we need to make sure people understand how they're getting swindled by big insurance companies, where our money goes, whether we're paying premiums or taxes. They're using our money, and you're right, it's wealth transfer from us to already wealthy shareholders. So a lot of the things we have to do is foundational. We need to stop some of the things that's going on right now to keep Medicare Advantage from being even more involved in our lives and taking more and more money from the government. We need to expose, as we do, how these companies behave. So my goal, and the reason I'm doing what I'm doing, is to make these companies toxic for politicians, for shareholders. I don't want politicians to take any money from these companies or their trade associations. I don't want people to invest in these companies. So we've got to do that work. And we've got to help people do a better job than we've done in the past of helping people understand the benefits of improving and expanding the Medicare program to cover all of us. We've tried that. We've not done as good a job as we need to, because the insurance industry, and I know this from having worked there, they're really, really, really good at scaring people, at lying, at misleading us. So we've got to anticipate what they're going to be doing, be ready for it the next time the stars align. And I think we will have that opportunity. We need to have national political leaders who stand up for it, who campaign on it. And we need to support candidates of all levels who support expanding and improving and expanding the Medicare program.
Now, the last question I always ask is, what should I have asked you that I forgot to ask you or that I didn't ask?
just about how big these corporations are. We're talking about mega corporations that not only these days provide insurance, but they're getting deeper and deeper into healthcare delivery. United Healthcare is just one part of this giant corporation called United Health Group that encompasses over nearly 3,000 subsidiaries. Most of them are physician practices and clinics. So they're not just insurance companies. They are getting deeper and deeper into healthcare delivery, which means that even if we're not enrolled in one of their health plans, we're still going to have to pay them money in some way. So they've gotten deeper into our lives. And United Health Group is the third largest company in America now in terms of revenue. So I want people to know these are massive. And Donald Trump got it right a few days ago. He called them big, bad, money-sucking companies. And that's one thing I agree with him on. At least he's saying it, and I'm saying that more and more people who identify as Republicans are beginning to see this. We've just got to tell this story more and more.
Wendell Potter, Healthcare Uncovered is the newsletter. Thank you so kindly for having been on Politics Done Right.
My pleasure. Thanks for having me on.